Hello, and welcome. You are watching Step Up Medicine's video on cardiovascular physiology, Episode 1. By the end of this video, you'll understand how the anatomy of the heart sets the stage for everything from electrical conduction to pressure-volume dynamics. This is the cardiovascular system from a physiologist's lens. Let's go. The heart has 4 chambers, 2 atria on top, 2 ventricles below. Functionally, the heart operates as a dual pump. The right side handles deoxygenated blood, the left side handles oxygenated blood. Let's follow the flow. Deoxygenated blood enters the right atrium from the superior and inferior vena cava. It passes through the tricuspid valve into the right ventricle. The right ventricle pumps it through the pulmonary valve into the pulmonary arteries, which carry it to the lungs. Now the oxygenated blood returns. It enters the left atrium via the pulmonary veins. It flows through the mitral valve into the left ventricle. And finally, it's ejected through the aortic valve into the aorta, supplying the entire body. Here's the key concept: the left ventricle has a thicker wall than the right. Why? Because it must pump against systemic vascular resistance, a much higher pressure system compared to the pulmonary circulation. The heart contains 4 valves to ensure blood flows in one direction. The AV, atrioventricular, valves, tricuspid on the right, mitral, or bicuspid, on the left. The semilunar valves, pulmonary on the right, aortic on the left. Valves are passive, they don't open or close actively. Instead, they respond to pressure gradients across the chambers. When the pressure behind a valve exceeds the pressure ahead, it opens. When the reverse is true, it closes. This creates the 2 classic heart sounds: S1 AV valves closing at the start of systole, S2 semilunar valves closing at the start of diastole.
Separating the left and right sides of the heart are septa. The interatrial septum, between the atria. The interventricular septum, which is thick and muscular, assisting the left ventricle in contraction. And remember, wall thickness reflects function. The left ventricle must generate around 120 mm of mercury of pressure. The right ventricle only needs about 25 mm of mercury to reach the lungs. This difference explains why diseases affecting the left heart, like hypertrophy or valve stenosis, have such a dramatic effect on systemic perfusion. Even though the heart is full of blood, it can't use the blood in its chambers for oxygen. That's why it has the coronary circulation, which arises from the aortic sinuses just beyond the aortic valve. The left coronary artery and right coronary artery supply oxygen-rich blood to the myocardium. We'll cover coronary physiology in more detail in a later episode, but for now, just know, without this supply, the pump fails.
Let's recap the most important points. The heart has 4 chambers: RA right pointing arrow, RV right pointing arrow, lungs right pointing arrow, LA right pointing arrow, LV right pointing arrow, body. AV valves, tricuspid and mitral, and semilunar valves, pulmonary and aortic, keep blood flowing forward. The left ventricle is thicker because it pumps against higher resistance. The interventricular septum is key in contraction. The heart gets its oxygen from the coronary arteries. Now test yourself with this quick quiz question. Which of the following correctly describes the event that causes the closure of the atrioventricular, AV, valves during the cardiac cycle? A. Contraction of the atria. B. Backflow of blood from the ventricles into the atria. C. Pressure in the ventricles exceeding pressure in the atria. D. Relaxation of the ventricles. Drop your answers in the comments. If you found this video useful, be sure to like and subscribe for more high-yield videos. Up next, we will be taking a closer look at cardiac muscle and action potentials. Thanks for watching and keep stepping up your knowledge.